India reported nearly 20,000 new cases of COVID-19 on Monday, a new daily record for the country. The spike comes after a jump of around 100,000 new cases reported in just the past week. India ranks fourth in the world with a total of almost 550,000 cases and over 16,000 people have died of the virus. India went into lockdown as early as the end of March, almost exactly 3 months later. Why the situation is still out of control and what's being done now to flatten the curve. Joining me from New Delhi is Srikanth Kondapalli, Professor of Chinese Studies at Jawaharlal Nehru University in New Delhi, and in Beijing, Professor Wenping, Senior Research Fellow at the Chinese Academy of Social Sciences. Welcome to both of you. Now, Professor Kondapalli, India's total confirmed cases, as I said, reached over 500,000, and according to World Health Organization number by June the 29th, it was also India's biggest single surge of new infections. So India, as I said, was under lockdown from end of March to end of May, 2 months. Exactly what key factors account for the high numbers of cases now, especially over the past week?
I think there is a lot of infections that have spread after the migrant workers have gone from the cities to the villages. An estimated 140 million people have gone when the lockdown was announced in March. So this has carried a lot of infections into the interior of India, number one. Number two, we have had the infections focused mainly in Delhi, Maharashtra, Gujarat and Tamil Nadu, 4 states. These states are exposed to foreign travel very much, and possibly that could be the second reason. For example, Mumbai, which is located in Maharashtra, which saw the largest number of cases so far in any single state, it has connection to the people coming from Saudi Arabia, Iran, or even Italy and Germany, where there has been a lot of infectious cases. So I think foreign travel, although there have been curbs since March, still that has led to a lot of infections. So that's the second reason why we are seeing, despite the lockdown. Third, of course, there is the asymptomatic cases and morbidity and mortality rates. This is because of the gradual spread of the disease in the society. This has picked up in various places through the foreign tourists, through others. So that is a third reason that has been mentioned in the Indian medical community.
Yeah.
So as a result, we have seen a hike in the. But
yeah, well, let me get back to you in just a moment.
But we are suggesting that this is a community transformation.
Let me ask Professor Wenping from China, from the reports that you have read, from the kind of information that you have been reading about. What do you think are some of the factors, and do you want to add into what Mr. Kondapalli just said?
Well, I think apart from those reasons raised by my Indian colleagues, I think maybe we can find some other reasons also. For example, how to closely tracing those people being infected, and also the people closely contacted. I think this is the key issue. For example, if you some people have been confirmed, and then you have to, check all the people contacted with these cases. Otherwise, these cases may go spreading very fast. So I don't think this like tracing closely with those contacted people around has been done in a very comprehensive way. At least according to the material I have been reading. And another reason is because we can see, like New Delhi, the capital city, now the cases being, confirmed there now is rising even faster than the used to be in Mumbai. So the reason is people complaining about the bureaucracy. Those city itself, mayor, now even give some order like today and then another day like tomorrow, even the federal, those officials coming from federal government, that is, a different party in charge, so they are coming conflicting with each other. So those order coming from different people in charge, so also make those governing issue is in some kind of chaos. I think this is somehow similar like what happening in the United States. Like in California, the state governor is coming from Democratic Party, and then the Republican, like in the White House, gave another order. So it's conflicting with each other, so bring the chaos. So I think this similar thing happening also in India, like in New Delhi.
Professor Kondapalli, what's your reaction to that? It seems that it comes down to the system, the political organization of India. We understand India takes a lot of pride in its democratic system. So what could be the advantages and disadvantages such a system could have in dealing with such a public health crisis?
I agree with Dr. Her's first point about not maintaining social stability, social distancing. That has led to a lot of spread of the virus in the slums and heavily populated regions. That is true. But I think in terms of the bureaucratic wrangling, this has been exaggerated. I live in Delhi, but I do not see the kind of bureaucratic wrangling has impacted on the public health system. It has a marginal impact, definitely. We have seen in other places as well, the bureaucratic local level administrations not really able to cope up. In terms of the advantages of India in the current case, as you raised the issue, I think it is relatively more open in the sense that while there are restrictions on people not leaving their homes, essential services, essential commodities, and the press is able to go ahead and do investigative journalism, do a lot of other reporting. They are free. Of course, some of the media personnel were also infected by COVID-19 as part of their duty when they were on duty. Yet I think this is one of the distinctive characteristics in the Indian tackling of the COVID-19, that it is more open, that there is criticism of the powers that be. So that is a huge advantage.
What about disadvantages? I mean, understandably, you have, as you said, journalists can criticize the policies, but has such criticism resulted in better policies, resulted in a more effective campaign to check the virus?
Indeed, in many cases it did result in, but overall we should say that the capacity of India in terms of public health infrastructure is pretty low. In the initial stages we have had just about 1,000 testing. Yesterday it was 170,000 cases were tested. So the testing has gone up, but in the initial periods we lost that momentum between March, April, May, where we should have done more aggressive testing. Secondly, more aggressive contacting of the virus, infected people. That is one weakness that we have done. Structurally, constitutionally as well, we have had some issues. For instance, the federal government and the states, they do have constitutional obligations, but also separation of powers. It does create some confusion because of the constitutional position. There is a state list, there is a concurrent list, there is a center list, that is federal list. This creates some confusion sometimes in terms of the competitive politics. It is true there is that element which creates some issues, but it also has some advantages that I just enumerated.
Yeah. Dr. He, what is your observation, or what can you tell us about Chinese scholars' observation looking at the situation in India? Of course, it's not it's not good news. I mean, to see a lot of people die, to see a lot of people fall ill. And let's not forget, India is also a developing country, just like China. So at this moment, with what sentiments are the Chinese scholars, at least, looking at the situation in India, and what has been shared by among them as to the possible causes of this dilemma, and where's the way out, possibly?
Yeah, I would like to share 2 points here. One is how to keep a balance between the economic development, especially now trying to reopen the economy and trying to boost in the economy, and then how to keep those virus spreading. Actually, this is dilemma. So this exactly a test for the government capacity. But we have seen, I agree with Indian colleagues saying, Indian government simply has wasted somehow those very valuable time, like in March, like in April, and in May, because those, frankly speaking, Indian government has been taking a very strong antivirus measures, such as the nationwide, this knockdown, these measures. That's very strong. But since the early June, and then in order to get this economy back up again, so reopen the economy, and then that we see those confirmed cases rising again. So I think somehow maybe you should sacrifice those economy if you put the people's lives first.
Some people would say, Dr. He, some people would say, we cannot sacrifice the economy, because if you sacrifice the economy, people will die too. People will lose their job. They probably die, because of starvation or whatsoever. So can you have both, according to China's experience? Because in the United States, we're all seeing they wanted to reopen the economy as fast as they can, and they have to step back. Professor He, briefly.
Yeah, because in China, we have been combined, like this anti-poverty campaign has been always becoming the priority concern. Even during the February, when the Wuhan was hit very seriously by this virus, and the Chinese government still had, this central government meeting talking about the anti-poverty issue. So we start this anti-poverty going on, and then of course you see a lot of people living in the slums, like the Indian cases, a lot of informal workers, they are trying to get those daily income to survive, just for keep the survive. Of course, it's becoming a great challenge there. So another point also links with this like political system or whatever, the governance capacity.
Well,
I think in India that is a private those health service system, and not that.
We have to leave it there. Dr. He, no more time left. We have to leave it there. Many thanks, Professor Srikanth Kondapalli and Dr. He from Beijing. And with that, we come to the end of this edition of The Point with me, Li Xin. Thanks for watching. You've got the point.